Sure. So the Odyssey tools were really designed to bring together the set of most common toolkits that people would use for doing observational clinical research. So if you wanted to ask a question of a health data set, what Odyssey has done is brought together in one package, which we call Atlas, a set of tools to understand your population, to understand individual cohorts within that population, and to be able to explore those for clinical research questions. It's actually a nice complement between FHIR and Odyssey, in that FHIR typically is at the individual patient level pulling data down, where Odyssey really typically looks things at a population level or at a cohort level. So they're very complementary, in fact. Sure, absolutely. So indeed, Atlas does roll together all of these different components that are part of doing observational research. So as you can see here, there's an initial piece which is around data set exploration. And if you look here and you click through to the individual data set explorer, you can pick a data set of interest. You can look graphically at the populations. You can look at how many people are taking different medications, how many people are taking, have different conditions on their list. So that's a key part of understanding, what do I have to begin with? What does my population look like? But if I want to go to the next level and build a particular cohort, which you would do if you were going to ask a question. For example, how many patients over 50 with diabetes are taking metformin? Well, you'd want to define, what do I mean by patients with diabetes? And to do that, we use the cohort builder tool over here. And by clicking through the cohort builder, you have an option you can see to graphically create and select a series of different conditions that are relevant to diabetes. You can select medications that are relevant to diabetes and laboratories, and those are all defined in this way here. You pick a concept set. That concept set is then created by a vocabulary explorer. And the vocabulary explorer says, let me look at metformin medications or other diabetes drugs. Let me look at ICD-9 codes that mean diabetes, and then go up to the parent level that can include SNOMED concepts, ICD-10 concepts, and so forth. And you roll those into concept sets. So the way that this vocabulary explorer complements the cohort builder is to allow you to create your little bundles of, when I say diabetes, here's what I mean in terms of codes. By doing this, we can then run these population level estimation analyses, which is that final piece of Atlas, where you can say, I want people who have diabetes and have taken metformin, and I want people who have diabetes and have taken other medications such as sulfonylureas, and I can look at the outcomes, and that could be looking at, for example, myocardial infarction. So by creating these three cohorts, our what we call a treatment cohort, what we call our comparator cohort, and our outcome cohort, we can then automatically run through the Atlas tool a very sophisticated analysis, which is rigorous and actually publishable almost directly from the code that's run in the Atlas tool. Exactly. And so one of the major initiatives that we're taking on this year here at Georgia Tech in collaboration with our colleagues at Stanford is building a formalized phenotype library where people can review what were the conditions that were considered in designing a given phenotype, what was the performance in terms of the precision and recall of a given cohort, and provide additional information so that if someone wants to reuse this cohort in their own environment, what they can expect in terms of its performance. We also encourage people who do run studies to upload their own findings as far as how well did this definition do in my local system, and it then allows us to produce better and better cohorts to share with the rest of the Odyssey community. It's a really exciting time. I think for Odyssey as a community that has now grown well beyond its roots, looking just at drug safety, into where we have people considering studies around genomics and around value-based care, certainly looking at population health writ large. We've even had a number of people say we want to look at clinical trials themselves using Odyssey, which is interesting given the original ideas around observational research and clinical trials being separate. The other big piece, though, is with FHIR, we're now seeing an easier pathway to go from EMR data of all stripes and from all different systems into an OMOP common data model. The GT on FHIR, or OMOP on FHIR project done here at Georgia Tech, allows people to very rapidly implement a conversion from FHIR into OMOP and take advantage of all the tools that OMOP has. At the same time, if someone builds a predictive model using advanced machine learning methods, many of which have been developed here at Georgia Tech or extensively refined here at Georgia Tech, those predictive models can then be run through an EMR system to actually do a prediction for an individual patient. So the connection between clinical decision support and large-scale analytics has really been enabled by this combination of FHIR and Odyssey together. So it's a great time to be working on this, and I think it's only going to grow in the years ahead. Thanks very much, Mark.